Welcome back to the front page. It's Wednesday, which means Dr. Bose is in answering all of your health and medical questions. Today we're talking about a topic that we've covered here at CBS 7, emergency rooms. With the boom and all the people coming to the area, emergency rooms and physician's office are very, very busy right now. And we have Dr. Sudip, who is a doctor in the ER at Medical Center Hospital. Doctor, what are you seeing?
You know, I've worked at Medical Center, I've worked in the busiest emergency rooms in Chicago. I've worked in many places, and it's very much a common scene. As I walk up the emergency department ramp through the double doors to start my shift in the emergency room, you know, there are ambulances lined up on the bay, the waiting room is stuffed, it's packed, you know, there are people lined up being seen in the hallways, and often, you know, unfortunately lack of privacy, and there are no rooms left. I mean, the ERs are overcrowded around the entire United States. This is a problem. And, you know, I would suggest, rather than waiting for a healthcare plan to fix this, you know, the informed public, can be educated about when an emergency department visit is appropriate and when you can go to an urgent care or somewhere like the primary doctor.
Right, because really it has an effect on the patient in many ways.
Right, it affects us, it affects our loved ones. It's sad when, you know, you're working in the emergency room and someone really sick is coming in and we have to divert them to another hospital. The ambulance literally has to divert to another hospital because the ERs are overcrowded. This is happening, you know, around the United States, there's an ambulance diverted once a minute. So this is happening very commonly. So
what can we do? What can a patient do?
I think the main thing is being informed. What things can you go to the urgent care for? And if you're not sure, there are nursing hotlines you can call. And a lot of this is common sense, you know, rashes, you know, minor dehydration, minor pain. But some of the things that aren't as much common sense is, you know, broken bones can go to an urgent care at times. And, you know, if the bone's not sticking through the skin and it's not majorly deformed, and it's just going to probably get some form of a cast, it can go to the urgent care. And even, you know, fevers, parents often bring their children in with fevers. You know, we as physicians aren't as worried about the height of the fever. I've seen patients with 101-degree fever who can be very sick, and ones with 104 who are climbing all over the furniture and, you know, grabbing at the stethoscope, and, you know, they're very active. So it's more how the child looks. So, you know, if the child looks well despite the temperature, you know, you can go to the urgent care.
We have 6-8 nurse you can call, and they really, there's nurses on the hotline that you can call and they'll tell you where you should go.
Right.
Don't just panic and go straight to the ER. Make a couple steps before that.
Exactly, and I think, you know, not only does this reduce cost, you know, an emergency department visit is very expensive, and this all ends up in our own pockets, you know, when it comes down to tax money and everything. And it also, it's just nice to have the ER beds open for that serious motorcycle accident, that heart attack, that stroke.
And it's less stressful. I mean, we all know ERs can be very stressful, especially a very busy ER. So it's less stress for you, the patient, or the parent of the patient, to be able to go to urgent care where things are a little bit more calm and like you said, free up that ER space for those serious injuries. All right, Dr. Sudip Bose, great advice always. And if you have any questions at home you would like answered here on the front page, go ahead and submit them to the email on your screen there or to the Facebook pages you're seeing right now. We'll be right back. Stay with us.